Hi everybody, it's Helena here. I'm sorry I'm a little bit late. We were trying to broadcast through Zoom and it went live for a few minutes and then it went down. So I'm going to kind of start over and I want to thank Don Logue for joining me. He is an advocate of good health care for everyone in our state. I'm trying to find a good angle for this. I'll just do it like this. And he works on healthcare issues, poverty issues. Don, do you want to tell us a little bit about the work that you do?
So I'm a former local public official that has over 20 years of experience in long-term care for individuals with a lot focused on seniors and persons with disabilities that need chronic disease management. And I've been advocating both in D.C. and in Jeff City and working with local candidates and public officials on how we can optimize positive outcomes and reduce costs in our healthcare system.
Okay, yeah, I mean, it's a really, really complicated issue, and I don't think there are many politicians or elected officials of any kind who can really fully grasp the whole thing. And solving the problems is an even greater challenge. And so I wanted to talk a little bit about the Democratic versus Republican sort of approaches to handling healthcare and poverty, and sort of the traps of both, and talk about how we move forward from here. And then more importantly, I'm just going to spend about 5 minutes on that. And then more importantly, we're going to talk about pre-COVID-19 versus post-COVID-19. Because I think that's really what we need to be focused on right now. There's a lot of work that people like Don have been doing to help advocate for women and children and seniors in our state, but everything's about to change. And so all that hard work and that expertise is going to come in. It's going to be even more important as we move forward after this challenge. So I wanted to start by talking about the different approaches and where we are right now. Democrats tend to want to provide care to the poor as much as possible in an effort to make sure that women, children, the disabled have the minimal amount of care that they need. And Republicans tend to want to not to have as few people on care as possible, few people on aid as possible, because they feel it's an incentive for people not to work. So what's happened in Missouri over time is that we have made it very difficult, more and more difficult to qualify for Medicaid. And the threshold is so difficult that if a person, basically for many services, if a person does find a full-time job at minimum wage, they lose many, many of their benefits. And so they end up having to choose, it's what we call the shelf, and they end up having to choose between getting promoted, getting more hours, and getting a better paycheck, and losing some of the services that made it possible for them to work. If they have children, maybe it's childcare, maybe if they have an illness, that they were able to stabilize and have medicine so that they can go to work and that they are healthy enough to work. And so they have to start making these tough choices. So in the end, it's ironic, but the effort on the conservative side to prevent people from being incentivized to not work is actually punishing poor people who do work and who are trying to get themselves out of poverty, pull themselves out of poverty. It's actually punishing them when they work. So that's, I think, a real problem with our approach previously. And I'm going to attempt to share a visual which shows what we currently spend on healthcare in Missouri. Let's see if I can do this. Okay. I had this all set up digitally on Zoom, but it's decided that it doesn't have the bandwidth today. Too many people are doing virtual meetings. So my apologies for Zoom. But anyway, we have almost 1 million enrollees in Medicaid and other, state health care, and we spend almost $10 billion, about $9 billion. So who's covered? Well, 63% of those people, more than that, are children and babies. 12.3% are pregnant women and very poor moms who are taking care of those babies. And 88.2% is the elderly, and 16.0% are the disabled. Now, how much do we spend on these different groups? Most of the money goes to the disabled and the elderly, and a relatively small amount goes to women and babies and children. And I want to point this out because in an effort to reduce the number of enrollees in our state, Republicans have been making it more and more difficult for women and children to stay enrolled. We know that a bunch of children got kicked off last year, and the governor has admitted that 60,000 of them were eligible for benefits and lost their health care for a time, and I hope they're getting re-registered on. I don't know the status of that, but I hope they are. The state is not, from what I understand, legally not allowed to remove the disabled and the elderly. So this is why they've opted to try to kick women and children off, even though that's the smaller amount of money that we already spend. And I would argue that money spent on children and on pregnant women so that we have healthy babies, healthy pregnancies, less maternal mortality, will help the next generation be healthier and be more productive. I mean, we all know that healthier babies do better long term, and even high school graduation rates are correlated to health. So we're not really doing ourselves any favors by trying to cut these folks off. Now, next thing I wanted to talk about was so the McKinsey report, which Don has been analyzing a lot. The governor asked for the McKinsey report to analyze our current healthcare. And I'm going to share a slide. Don can see it, but nobody else can. I'm going to try so he can see what I'm trying to get at here. But the McKinsey report basically said that right now, cost containment is the goal, right? And that's the conservative attempt, is to try to have as little cost as possible, as few enrollees as possible. But it says that the system is dysfunctional. We have all these departments and nonprofits that are trying to work together. There's poor coordination, poor strategy, and it's hard for people to get care. And I would say that basically there are lots of good people trying to do the right thing. It's just inefficient. Because we don't want to invest in the system, we are letting it stay kind of piecemeal, unorganized, and therefore inefficient. And what the McKinsey report recommends is value-based coordination towards better outcomes. And that a value-based system would reward providers for quality and efficiency. And so basically making sure that people stay healthy, because healthier people are less expensive to care for, quite frankly. And, why should I care about state health care? If I have my own insurance, I have a job, I have health insurance, I don't want to pay for their health insurance. I don't want to pay tax dollars that go to that. A lot of people feel that way. The problem with that is that we are already paying for it. So anytime there are healthcare costs that are not paid for by somebody in a hospital, at the end of the year, the hospital reevaluates how much it's brought in, how much it's lost, and it shifts all of that cost to the insurance premiums for the next year. So, and I learned this with my good friend Judy. She and I sat down with an insurance manager and talked about the system, the antiquated system that much of the country still uses to reimburse doctors and hospitals for their services. But basically, we end up paying for it, and we end up paying for it in our premiums and in our co-pays and our prescriptions. Is what I'm saying following, Don? Have I said anything that's not right?
Absolutely. Yeah.
Okay.
The ripple effect also goes right into our, do we have a workforce available that's healthy? I mean, it's a very, very dramatic impact throughout our whole society.
Yeah, it really is. And I wanted to say, when we look at this number again, I was trying to figure this out, okay? We only have a population of, I think, 6 million people plus in Missouri. That means almost 1 in 6 people is covered in some way. And that's the elderly, that's disabled, it's everybody. So I don't feel like any Republican, well, I can't say this, I can't speak for other people, but in my mind, everybody has a different philosophy, but most of us are trying to do the best that we can. I can't imagine that somebody would say, oh, I think that disabled person, their wheelchair no longer works. I don't think they should be getting a new wheelchair. I don't want to pay for that. Let them just crawl across the street. I mean, I just don't think people really would go there. But that's what it really means. There are a lot of choices people are making between rent and prescriptions. Between, I can't go to the doctor, I can't afford it, I'm going to get bills, I'll just wait and see if I get better. And let me tell you, my mother-in-law was recently in the hospital. She's getting out of rehab tomorrow. She's 83. She is not on any assistance at all, but she waited. She didn't want to go to the doctor. She didn't think enough about her condition, and she let something get much more further along in its progression to where it was a much bigger deal to take care of. And that's what happens, right? People don't get care. They don't get preventative care. They don't get care early on. They don't keep their conditions, whether it's high blood pressure or diabetes or mental health issues. They don't take their meds, and they end up not being able to work, or not being able to leave their homes, or getting huge bills later down the line. So it's all shifted to us. And by the way, it's shifted to small businesses and large businesses who provide insurance to folks. So your copay may go up, your prescriptions may go up, but your employer's health care probably is a huge amount of what they have to pay for. And that's a burden on them. So let me see what I was going to say next. So there's different approaches. There's the short-term cost reduction, which is what the conservatives are going for right now. Short-term, let's kick people off, as many people as possible, make it as difficult as possible to receive care, because then we won't have to pay for it, and they will have an incentive to work. Of course, those babies can't work, and those children can't work, and they did not choose their situation. So we do need to think about that. The recommendations from the McKinsey report, the governor's own report, are that we need to invest in long-term care reduction, because we want to give better care with better outcomes. So you're incentivizing doctors and reimbursing them based on the care that they're giving and the outcomes of their patients. So they have an incentive to follow up. They have an incentive to think long term, not just, oh, I'll prescribe an antibiotic and it'll be fine and I'll never see that person again. That's not what we want, because that doesn't work. Healthier babies equals healthier children equals more productive adults. And that's what we want. But that, the short-term cost reduction wins a lot of political points. Oh, we're going to lower taxes. We're not going to pay for these people. Your taxes will go down. It's a great way to earn votes at the ballot box. What takes real leadership is long-term planning, is a long-term goal that truly serves the people of Missouri. And the U.S. poverty rate is 12.3. We're a little over 14%. So, it's not going anywhere. The whole country is in this situation. And that's pre-COVID-19, okay? What happens after we flatten the curve? Well, the U.S. economy is projected right now to shrink by about 34%. 34%. We already have the slimmest budget and the least services possible, basically, in this state. And we are not going to have reserves or extra money to pay for anything, right? And we are also going to probably need a lot of federal assistance. The healthcare situation is only going to get worse. There will be more people who don't have jobs. There will be more people who suddenly qualify for Medicaid who didn't qualify for it before. And maybe not. Maybe there'll just be more uninsured people because they don't qualify for Medicaid because they're not a pregnant woman or a child or the disabled. We don't cover poor unemployed men. So what is everybody going to do when they lose their jobs? we're going to have a big problem. So I think the reaction, unfortunately, is going to be do nothing and to just keep the status quo and try to kick more people off because we can't pay for them. We simply can't pay for it. But I think the efficiency that the McKinsey report is talking about is where we need to look, because we need to make the dollars we have left go even further. I mean, that's the reality of the situation. Now, in terms of the federal money, and I'm about to run out of time, but we did start late because Zoom cut us off, so I'm going to go another couple minutes. The federal assistance that has been allocated, about $2 billion is estimated to come to Missouri. That sounds like a lot, but of course it's not. But we do need that money. We need every cent of that money to help our economy recover, to help our families who lose their jobs survive, and to help our small businesses come back, and to help make sure that people still have medical care. And believe me, I know the president said yesterday that he's working with the insurance companies to make sure that the COVID-19 testing is free and that some of them are agreeing to pay for the expenses for free. Now, I would assume all that's still in the negotiating phase, but the taxpayers are still going to pay for it. These are for-profit companies, and that's the way our system is. And so we're going to pay for it down the line. It might be in 3 years. It might be in 2 years. We're going to pay for it, okay? So let's just keep that in mind. Nothing is free in this world, nothing. But there are things that our state leaders can do. And what they can do is to make sure that our residents can get the resources that the federal government is giving to them in terms of unemployment, in terms of Medicaid. The government is offering to help us expand Medicaid to cover folks. Our leadership at the state level needs to rethink their approach. If Donald Trump is allowing this, if he is encouraging this, if he is coming to our rescue and giving us this money, Missouri needs to take another look at its approach to Medicaid and take what is handed to us. It is not a handout. We have been paying taxes. We are productive members of society. We are a productive state, and we deserve that help. We need to make sure that people can get those benefits and get them in a streamlined, efficient way. Last year, the Missouri, Health Department basically for Medicaid made it more difficult to qualify. They made the paperwork more difficult. They made the deadlines harsher. If you missed a deadline or were late, you were cut off permanently. We need to make it easy and streamlined for people to access what the federal government has to offer. Missouri, I don't think our government can withstand this contraction in our economy, and we need to make sure we survive and that we rebuild and we're stronger afterwards. So I would encourage everybody to, when you call the governor and ask him to, have a stay-at-home order, also ask him to make sure that our unemployment links are ready to go. As of yesterday or 2 days ago, they weren't up and ready. Other states, I think, have them already up and running. Let's make sure that our poorer families can still get their food benefits, can still get Medicaid, and then let's see how we can expand it to help these families who, through no fault of their own, are losing their jobs and will not have the money they need to buy food and pay for their bills. So I just wanted to say that if I was elected in November, that's what I would be doing at the state level. I would be looking at how we can improve our situation, how we can definitely take advantage of federal dollars that are allocated to us that we are welcome to, and make sure that we give our economy a chance to recover by remembering that it's not just those of us staying at home working virtually who have a salary and who have not been furloughed, but it's also hourly workers, people who are going to be losing their jobs as salespeople in our retail stores, small business owners, and our hourly workers, including, custodians, mechanics. Everybody who may lose a job needs our help. And we're all in this together. And that's what I would be focusing on. And I hope you all have a great day. I hope you found this informative. And if anybody wants that little visual that I sent to you, that I put up here, I will send it to you if you want to text me or message me your email address. I'd be happy to share. Thank you so much, and let's show some leadership. Let's try to encourage our governor to show some leadership. We are trying to be the last state to shut down, I suppose. I don't know why we want to be in last place, but I would like us to be much better off than that at the end of this. Thanks so much. Have a great day, and I'll talk to you tomorrow. Take care.